Let us discuss about antifungal drugs. These antifungal drugs they are classified into antibiotics, antimetabolics, azoles, alkalamines, and other topic agents. Now we'll discuss about only polyenes which come under antibiotics. Under these polyenes we have amphotericin B, nystatin, and hemicinin. Now coming to mechanism of action of these polyenes, what they do is these polyenes they go and bind to ergosterol which is there in the fungal cell membrane, and by binding this to this ergosterol, many polyenes they form a channel in the cell membrane. They form a channel in the cell membrane of that fungus. Through this forms a pore. Through this pore, all the electrolytes and the contents of cell will comes out through this pore, and thereby causing the destruction of fungus. And this ergosterol, the cholesterol which is there in our body, it resembles the ergosterol. So the antifungals which are binding to ergosterol will also bind to cholesterol which is there in our body, thereby causing toxicity to the body. And one more thing is that in the bacteria there is no ergosterol, so there will be no action of this antifungals this amphotericin, all these drugs in the bacteria. And it has also found recently that this amphotericin B which comes under this polyenes will improve immune system in the animals and to some extent even in the humans. So it can be used in immunocompromised state, so that we can boost the immune system of immunocompromised. And we are mainly discussing about amphotericin B now. As the amphotericin B is, as said, the mechanism action by forming membrane pore, they cause destruction of this fungal, and the adverse effect in humans is due to similar resemblance of human cholesterol to ergosterol, and it is not effective in bacteria as there is no ergosterol, and it boosts the immune system. Coming to spectrum of antifungal spectrum, it is the active agonist various wide range of yeasts and fungi like Candida albicans, Histoplasma capsulatans, Cryptococcus neoformis, Blastomyces dermatitis, Coccidioides imitates, and all these things. And at high concentration it is cidal, at low concentration it is static. And it has also found that it is very effective against leishmaniasis, which is a protozoan. It is used in actually resistant case of leishmaniasis. Coming to pharmacokinetics of this amphotericin B, amphotericin B is not observed orally. We can use it for intestinal candidiasis. Okay, it can be used for intestinal candidiasis, but it is not observable from the intestine. And after absorption, it has got very large volume of diffusion in the plasma. It binds to plasma proteins and the cholesterol in the body, and it is metabolized mainly in the liver. Actually 60% of metabolism takes place in liver, and it is excreted in the urine as well as in the bile, but in urine the extent is very less, and the half-life is around 15 days. It cannot attain good concentration in CSF. Hence we cannot, if you want to use for any meningitis, we can use for intrathecally. Coming to adverse effects of this amphotericin B, and this amphotericin B has got acute reactions and long-term toxicity. Coming to acute reactions, acute reaction will manifest in the form of fever, chills, aches, pain, allure, and nausea, vomiting, and dyspnea. This acute reaction can be overcome by infusing hydrocortisone 0.6 milligrams per kg. This reduces the intensity of these acute reactions. and there is thrombophlebitis of infected veins will also occur. Coming to long-term toxicity, the long-term toxicity mainly of two types. Mainly two things happens in long-term toxicity. One is nephrotoxicity and the another one is anemia. Coming to nephrotoxicity, this nephrotoxicity will manifest in the form of azotemia, reduced glomerular filtration rate, and inability to concentrate urine, inability to concentrate urine, hypokalemia will also occur. All these things, after discontinuation of drug, almost this recovery from these effects is very slow. But sometimes the recovery is not complete. We will find some residual impairment present, will be present after discontinuation of drug. And coming to anemia, this is mainly due to bone marrow suppression, and this completely resolves after discontinuing the drug. And uses, coming to uses, this uses of this amphotericin is mainly systemically. This has considered gold standard for systemic mycosis, and this can be used as topically for oral, vaginal, and cutaneous candidiasis, even otomycosis. And this also used for febrile neutropenia. This febrile neutropenia, which is not responding to bactericidal antibiotics, can respond to this amphotericin B. Coming to leishmaniasis, as I said you before, this can be used in restricted case of leishmaniasis, mainly cathalizer and mucocutaneous leishmaniasis. Coming to nystatin, the nystatin has got similar action and pharmacological profile as that of this amphotericin B, and due to this higher systemic toxicity, it is used only for topical uses like oral candidiasis, vaginal candidiasis, like this. Mostly it is used for superficial candidiasis. Orally it is like amphotericin B, it is also not absorbed, and it's mainly used for monodial diarrhea, which is due to superinfection, and it is also used for monodial vaginitis. Monodial vaginitis, and it can be used for oral candidiasis. For oral candidiasis, the vaginal tabs are crushed, and these are mixed these are made suspension with the form of glycerin and applied over the oral mucosa for treatment of oral candidiasis. Similarly, it can be used for corneal, conjunctival, and cutaneous candidiasis as well. This is something about amphotericin B and nystatin. Thank you for watching.